This is what happens when you don't listen to your endodontist. All right. But first, let's talk about the story. So this patient came to see me in 2020, so 3 years ago, for endodontic treatment of teeth number 12 and 14. She had received restorations on these teeth, and they were both in the state of irreversible pulpitis. So we decided to do the one that was bothering her the most, tooth number 12, RCT first, and then she was supposed to come back so I can work on tooth number 14. So we did tooth number 12, RCT in 2020. Let me show you. So this is immediately after we did the root canal on tooth number 12. And here is the date, as you can see, 2020, so 3 years ago. And as I said, she was supposed to come back so we could work on tooth number 14. This was just now, 3 years post-op of tooth number 12. As you can see, my root canal is doing beautifully. Tooth has a crown on it, and as you can see, again, tooth is doing beautifully. So 3 years post-op of tooth number 12. If root canals are done properly and the coronal coverage seal is good, they will last a lifetime. All right, so 3 years post-op of tooth number 12 that we did in 2020. Now, look what happened to tooth number 14. Now, patient came in because now, of course, she has a abscess. This tooth is abscessed, as you can see, periapical lucency here and here. And let me show you the clinical presentation. And take a look here. Now she comes back with this. All right. If she had come back 3 years ago, as we had recommended for us to do root canal on tooth number 14, as we had recommended, as I said, 3 years ago, the prognosis for the tooth was much better, because at that time the pulp was alive. There was no infection. Now the prognosis is guarded, because now we have to deal with an abscess tooth, with an infection. We have to deal with bacteria, microorganisms. All right, so listen to us when we recommend a root canal, because this could be the outcome. Now, as I said, the prognosis for endodontic treatment is lower as compared to 3 years ago when the pulp was still alive. All right, so we schedule her to come back so we can do an RCT on tooth number 14.